this video, we're going to talk about 4 everyday caregiving tasks that are not nurse delegable and why that matters for your role as a caregiver. These tasks include personal care, basic first aid, medication assistance, and self-directed care. By the end of this video, you'll understand why these tasks don't require nurse delegation and how you can provide them safely and confidently. Let's start with the basics. What does delegable mean? Nurse delegation means a registered nurse gives a caregiver permission to perform certain nursing tasks. Examples of this are things like giving insulin or flushing a catheter, but not everything requires delegation. Some tasks are considered non-nursing and they're a part of your regular caregiving role. These tasks are routine, low risk, and do not require nursing judgment. You don't need a nurse's written instruction to do these, but you do need to understand how to do them correctly and safely. Personal care includes helping clients with their daily needs, like bathing, dressing, toileting, and eating. These tasks are essential for your client's comfort and dignity, but they are not necessarily medical and they shouldn't require clinical judgment or special nursing knowledge. That's why personal care is not delegated. As a caregiver, you're already trained to do this through your HCA, NAC, or NAR. Your role is to be gentle, respectful, encourage independence, report any changes, and follow infection control and safety practices. Basic first aid means simple care for minor injuries like small cuts and scrapes, bruises, or applying band-aids or ice packs. You are allowed and expected to provide this kind of first aid as part of your job. It keeps clients comfortable and prevents minor issues from becoming worse. But if something goes beyond minor first aid, like a deeper wound or a burn, stop and call the nurse. That might need nurse delegation or direct medical care. If it is an emergency, do not call your nurse, call 911. Remember to always use clean supplies, stay calm, and follow your training and report all injuries and actions taken. Another non-delegable task is medication assistance. I have a separate video for this that goes into more detail, but here are the basics. This is when you help a client take their own medication, like reminding them to take a pill, handing them their inhaler, things like that. They are in control and they know what the medication is for and when to take it. You're just helping them follow their routine. Because you are not giving the medication or making decisions about it, this task does not require delegation. But be careful, because if you're doing something like applying a transdermal patch or putting medication directly in someone's mouth or eye, that's medication administration and it does require nurse delegation. Always know where the line is between assisting and administering. When in doubt, ask your nurse delegator. Let's talk about self-directed care. This means the client does their own care as much as possible and they decide how and when that care is provided. You may support them by setting up supplies, reminding them, or standing by for safety, but the client is doing the task, making the decisions, and managing their care. That means it's not a nursing task and does not require delegation. This matters because it supports independence, respects the client's rights, and it builds trust and dignity. Your job is to support and not take over unless their abilities change, in which case you should report that to the nurse. Keep in mind, though, that according to Washington state regulations, self-directed care must be directed by the adult client and carried out by an individual provider, or IP. The client is responsible for training the IP in the specific health-related tasks. Caregivers employed by home care agencies are not permitted to perform self-directed care tasks. Let's quickly review the 4 tasks that are not nurse delegable and why. Personal care is a routine daily task and there shouldn't be medical decisions needed. Basic first aid is just a simple response to minor injuries without nursing judgment. Medication assistance is when the client is in control and you are just helping. Self-directed care is when the client leads and caregivers offer support. These tasks are part of your regular caregiving duties. You don't need special delegation, but you do need to know your limits, follow your training, and communicate with your nurse. Always ask your nurse delegator if you are unsure. Please remember to always follow the specific instructions provided by the delegating nurse assigned to your client. Their directions take priority over any information presented here. Feel free to leave a comment to stimulate a conversation or add value to our practice. I'd love to hear your thoughts on this.